Hello,
Hey,
how are you?
good. How are you?
I'm fine. Sorry about that. I was digging for a pen and I got a
Oh gosh, no, it's okay.
I'm Angela Fateh. So nice
Hi.
to have you. I really
Hi.
appreciate you joining.
Of course, of course.
Jolie, are we ready? She may be letting in some others. How's your day going so far?
It's good.
Okay.
I'm in clinic, and so I was able to step away for a couple minutes, which is great.
All right. I don't think we're recording yet. So are you at Herman Memorial?
Um,
Okay. My husband used to work at Herman Memorial in Sugar Land.
oh, nice.
Yeah. Many moons ago.
Yeah. I didn't realize that you were in Houston.
I'm not. We're in
Oh,
Atlanta.
now
Um,
you're in Atlanta.
yeah.
Oh, okay.
We lived down in Sugar Land. I don't know. It's probably been 10 years now.
Oh,
So,
nice.
yeah.
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 I'm just at the medical center now.
Okay. All right. Are you a family physician or
Oh no, I'm a gynecologic
you're the
oncologist.
gynecologist?
Yeah.
Okay. That's what
No,
I
I'm a gynecologic oncologist. So I would do women's cancer
oh,
surgery and chemotherapy.
oncologist. Gotcha.
Yeah.
Gotcha. Super, super cool. Very cool. Okay. You there, Joey? You're on mute if you are.
Oh, yes, I was trying to text you. Hi, yeah. How are you, Dr. Z?
Hi.
So I'm going to mute myself again, and then once you guys start, I'll go ahead and start recording.
Okay. And just so that I make sure that I get your name correctly, pronounce it for me.
It's Abigail Zamorano.
Abigail Zamorano. Okay. All right. And you know what I did not do? I did not print off those questions. All right. So I'm gonna have to get them from my phone. Hold on.
Okay.
Hold on 1 second, Jolie. Uh, okay. All right. Got them. Okay. I think we are ready. Um, Off the sweater. All right, you ready, Jolie?
Yes.
Okay, you can go ahead and record. Okay. Um, welcome, welcome everyone. My name is Angela Fateh. I am a co-founder of a health initiative which basically focuses on cervical cancer and breast cancer in women of color. The organization is called Glow Up Garden. Our other co-founder, her name is Jolie Blunt. She also is the director of her nonprofit, which is uh, OIFCC, Organization for, I'm gonna mess that up, Jolie. Let's start over. One quick second.
I'm gonna turn also since we're gonna start over. I think that
Okay,
it may be better. The light is terrible, but
okay. Jolie, it's organization. I always get your thing wrong.
Just say IFCC.
IFCC. Okay. All right. Starting again. Last time, I promise we're gonna get through it. Um, you ready, Jolie?
so here.
Okay, you're
But that's
good.
fine. Yeah, I think that's good. Mm,
You're good.
I don't know. I just hope no one walks in.
Hello, my name is Angela Fateh. I am the co-founder of Glow Up Garden, which is an initiative for women of color who may experience cervical cancer and breast cancer at a disproportionate rate. And our organization is basically to help women be aware of these diseases as well as to provide some action and advocacy around just ensuring that they are taking care of themselves in the proper way in terms of getting treatment and being seen by physicians. So we are excited this month is January, or January is cervical cancer month. And so we're really excited to be able to bring you all some amazing guest speakers to give us some information about cervical cancer. We do have on Dr. Abigail Zamorano, and she is a gynecologist in Houston, and her specialty is gynecologic oncology. And so, Dr. Zamorano, I would love for you to give us a little bit more background about yourself, and then we can kind of dig into the subject matter.
Sure. Thank you so much for having me here. I'm really excited to talk about this topic. I am, as you said, a gynecologic oncologist. So I manage cancers of the female reproductive system. So cervical cancer, vulvar, vaginal, uterine, ovarian, among others. That means that I do the surgery and provide the chemotherapy. So it's full spectrum care. But a lot of what I also do is cancer prevention. So, in addition to my day-to-day job, I'm also the director of the Houston PAP project, which is a program that provides no-cost cervical cancer screening, as well as the diagnosis and management of cervical precancer to an underserved urban Houston population, which includes a lot of Black and Brown women. And so I'm very passionate about increasing access to care, specifically to cancer prevention and cancer screening. And so I'm really excited to talk about this topic and try to get the word out on how important it is to screen and prevent cervical cancer.
Okay. All right, great. Well, welcome. We really appreciate your time. We would love to get your explanation or your definition of cervical cancer, what it is and what causes it.
Sure. So cervical cancer is cancer of the uterine cervix. The cervix is the opening of the uterus, or the opening of the womb, as some people call it. It is located at the very top of the vagina. It is visualized in a pelvic exam by a provider with a speculum. So a speculum is placed in the vagina and they can see the cervix. Cancer of the uterine cervix can develop for many reasons, but most, as in almost 99% of cervical cancers, are actually caused by the human papillomavirus, or HPV. And we can talk about that as a method of prevention in a little bit. But essentially, there are certain high-risk strains of the human papillomavirus that tend to linger and cause cell changes of the uterine cervix, which then can become a cervical precancer, which then can become a cervical cancer. So it's a cancer of the cervix, but once it has developed, it can grow and it can spread to other areas of the body.
Okay. All right. And can you give us some information or just insight into why cervical cancer affects Black and Brown women disproportionately?
So a lot of this has to do with access to cervical cancer prevention strategies, including cervical cancer screening. So we've seen a lot of my research is predominantly in the Hispanic population, but the same holds true for the Black population, that we've seen a lot of individuals don't necessarily prioritize their own health. They're very busy and they're working, they're taking care of family members, they're doing other things in their life. Or they maybe know that they need to do some cancer screening, but they're afraid of finding the right doctor, finding someone who will listen to them. Or maybe they just don't have access to care. Maybe they have trouble getting to the doctor, whether it's because they live far away or they don't have the capabilities to access the doctor for insurance or other transportation reasons. There's a multitude of reasons, but all of these barriers tend to be more dominant or more prolific in the Black and Brown population. So as a result, that means that in general, and these are pretty big generalities, but in general, these individuals are less likely to get screened. So they're less likely to have a cervical precancer diagnosed, which means that precancer is more likely than to become a cervical cancer.
Okay. And so how do you get HPV?
So HPV is a sexually transmitted infection. So it is transmitted sexually like any other STD.
Mhm.
However, it's a little bit different than other STDs. And so I try really hard to not to explain that it shouldn't carry the same stigma that other STDs should. Um, HPV is one that someone can acquire, and in fact, almost 90% of men and women are exposed to and have HPV at some point in their life. So it's incredibly prolific.
Mhm.
But someone can obtain HPV and have it linger for almost the entirety of their life and maybe never know about it.
Mhm.
Most HPV strains, once they're obtained by a person, their body's own immune system actually fights it off and clears it, just like any other virus that you might get, like a common cold.
Mhm.
Your body's own immune system does a really good job. But there are certain high risk strains that are just harder for the body to get rid of. And those are the ones that are more likely to stick around and cause those cellular changes that can cause the precancer and cancer. I will
Mhm.
say that it's not unique to cancer of the cervix. HPV can also cause vaginal cancer, vulvar cancer, or pharyngeal cancer, penile cancer. There's many different cancers that HPV can cause, and so this isn't even an issue that's unique to individuals with the female reproductive system. It
Mhm.
also applies to those with the male reproductive system.
Okay. And HPV stands for
The
what?
human papillomavirus.
Okay, human papillomavirus. And so it sounds as though it's extremely important, obviously, to ensure that we are able to see a gynecologist or a physician that specializes in gynecologic services to ensure that we are screened routinely if we're sexually active. Is that what you
Yeah,
said?
but actually, women, anyone with a cervix, should be screened starting at age 21, regardless of onset of sexual activity.
Okay.
That is because there are some cervical cancers that can develop without HPV, and so you still want to get screened just to make sure that if it's it's less common, but
Mhm.
if something like that develops, you definitely want to catch it early.
Right. Okay. All right. Well, and so as you answered one of my questions, which was how early should you get your first pap smear? So if even if you aren't sexually active, what is the age?
The recommendation, regardless of onset of sexual activity, is age 21.
Mhm.
I will say that I think a lot of individuals go to a gynecologist for their pap smear, but
Mhm.
there are a fair number of family medicine physicians that also do pap smears and pelvic
Mhm.
exams,
Mhm.
or people in other specialties. There are also some newer tests that are self-collection tests.
Mhm.
Um,
Mhm. Oh,
for
really?
individuals, yes. And so those
Amazing.
are available everywhere. Um,
Mhm.
but they've recently been approved. And so this is a really good option to increase screening, especially for individuals that maybe see a type of doctor that does not do pelvic exams.
Mhm.
They could potentially talk to that doctor to see if they could do one of these self-collection tests. They
Mhm.
could still get screened.
Mhm.
Um, and then it's also a good option potentially for individuals that have some anxiety or fear of
Mhm.
pelvic exams.
Mhm.
I do think it's important to still have a pelvic exam in one's life because there's a
Mhm.
lot that we learn from an exam that's not just the pap smear.
Right.
Um, but I think for individuals that have that fear, I mean, the more individuals that we can screen, the better.
Okay. And so the self-collection, is it specifically for HPV screening or is it just, it's all cervical cancer?
So it's specifically for HPV screening,
Okay.
but it then allows a triage. So if it comes back abnormal, especially for one of the high risk strains, then
Mhm.
you would follow it up with other tests and other exams that
Mhm.
would potentially diagnose a precancer that could then be treated.
Okay. Well, and to kind of wrap up and sum up our discussion, obviously one of the biggest barriers is access for Black and Brown women. Um, and that can come in many forms, as you've described. So, what do you suggest for women who just may not have insurance, are the self-tests, are they available for, maybe women who are on Medicare or Medicaid, or may not have insurance at all? What would you recommend?
So for those who don't have insurance, check within your community to see if there are no cost clinics like the one that I run. We are grant funded, and so our patients don't pay anything for any of their exams or tests.
Mhm,
So you can always check your community to see if something like our clinic exists.
mhm.
And if anyone is in Houston and needs screening, we're the Houston PAP project.
Okay.
Um, but otherwise, so check within the community because there are some pretty good community resources.
Mhm,
Some county hospital systems have screening programs.
mhm,
Um, in terms of the self-collection, it is still a little bit dependent on the clinic and hospital system as to who is offering this.
mhm,
In the US, it's not currently the type of test that one can order on their own and
mhm,
then submit to an external lab. It has to be done through a clinic or a provider.
mhm.
Um, but you can always ask your provider if that is something that they are now offering or if they would consider offering.
Mhm. Okay. And so, last question. You recommend pap smears for women, and I know their age, depending on your age. Can you
Mhm.
tell me routinely should we be getting pap smears?
So for individuals under 30, it should be
Mhm.
every 3 years. And
Okay.
then after age 30, and from 30 to about age 65, it should be every 5 years, as long as they're all normal. The
Okay.
key to that upper age, though, is that at 65, you really have to have demonstrated that you've had normal pap smears for at least 10 years with routine screening.
Mm.
Just because you turn 65 doesn't mean that you should stop screening because, as I said, the human papillomavirus HPV is something that can linger for some
Mhm.
time,
Mhm.
and you don't want to think that you're out of the screening age range
Mhm.
only then to have HPV kind of resurface and then lead to a cervical cancer because we do see cervix cancer in elderly, I mean, or older, over age 65 populations.
Okay. All right.
Yeah, of
Well, we greatly appreciate your time today, Dr.
course.
Navarano. Thank you so much. And we hope that we'll be able to do more with you around this subject and also breast cancer as well, if that is an area that you specialize in as well. So,
I don't do breast, but I'm happy to find the person for you who could.
okay. All right. Sounds good. Well, thank you. We appreciate you taking out time.
Of course,
All
of
right.
course. Nice to talk to you.
You as well. Have a good day.
Mhm.
Hi, Imelda. How are
Hey,
you?
I'm doing very well, Angela. How are you?
I'm doing well, thank you. Thank you, thank you. Thank you for joining us. We appreciate you joining.
Of
Um,
course, it's my pleasure.
yeah, so I did want to, I'm sorry, what I will not do is pronounce your last name because I will not get it right.
Okay.
So, can you give us a little backstory about yourself? So I know you are a cervical cancer survivor.
I
Um,
am.
give us some details about who you are and your story around surviving cervical cancer.
Sure. Thank you so much. So my name is Imelda. My last name is Din Jakat. So the first N is silent. As most
Mhm,
names in Africa, they have meaning. So that's why it's so long. So,
mhm,
but anyways, a little bit about me. I am a mother of 6 children,
no,
and I have a wonderful husband. And together we do a lot of community work in a country called Cameroon.
mhm,
Cameroon is not very well known by so many people, but every time I talk about Cameroon, I always refer to Nigeria, which many people know. And I'm like, we share the same boundary with Nigeria. And people go,
yes.
ah, okay. So that's where I come from. So my story of cervical cancer started in 2017. It wasn't fully developed as cancer just yet, and I'm going as far back as 2017 because I want to really educate women on what happened to me then. I went and saw my primary care physician, and that was just because I was going in for my regular exam. And on
Mhm,
going to see her, she saw some abnormal cells. So she asked me to go back to my gynecologist to go make sure that everything was fine. And when I went, he sent in those abnormal cells to the lab, and they came back as precancerous.
Mm.
So when it came back as precancerous, I had two options: to do a cone biopsy, which means go around my cervix and then cut it off like a cone to prevent those precancerous cells from becoming cancer, or I had the option of doing a total hysterectomy. But at the time, if I knew what I knew now, I should have gone for a total hysterectomy.
Hmm.
So I did a cone biopsy, and because I'm a nurse, so I went back to nursing school. I was so busy, I never went back after the 6 months that I was asked to come to make sure that these cells had not fully developed into cancer.
Hmm.
And lo and behold, fast forward 2019, I go now back to see my doctor, and now this is full-blown cancer.
Oh, wow.
So that is how my journey began. And I went through multiple rounds of chemotherapy, multiple rounds of radiation. It wasn't an easy journey. I lost a lot of weight. Don't see me now. Let this not fool you, but I was really like very skinny. And so throughout that ordeal, I'm a strong believer in God.
Yes.
And so I believed at that time, and I told God, if you give me a second chance to stay alive, I'm going to use the rest of my life to talk to women about cervical cancer and the dangers of cervical cancer, because it's so slow. We have no family history except for my younger sister, who was diagnosed with cervical cancer just 2 years prior to mine. And so I decided
Really?
when I got better 2 years later to start going to Africa, because I told myself that if I am in a country, the United States, where I have the best medical insurance, I had it all, and I almost died here.
Wow.
What more of my mothers, my sisters back there in Africa who barely have any medical insurance to live by? And so because we had already started a hospital, my husband and I, in Cameroon, I used that area to sensitize women. We started a group today called Grace Gardens Women's Health Association, and we have more than 300 women in this group. And I educate them on a bi-weekly basis. I get on Zoom and I teach them about cervical cancers and other cancers, and beyond that, everything that has to do with women. So it becomes like a something that is really passionate. I'm very passionate about, and I tell women, even if you don't feel the symptoms, get yourself checked.
Yes,
Because
absolutely.
yeah, get
Yeah.
yourself checked.
So, when you discovered when the doctors discovered the precancerous cells, had you finished having your children at that point, or?
That's a very good question. Yes, I had finished having my children at that point. And that's exactly why I said I regret my decision of not going for a total hysterectomy, because I was of the mindset that I want to die with all of my organs in my body and things like that. I think I was very naive.
And how
But
old were you when they discovered the cells?
I was 39.
39.
39, yes. I was
Okay.
39 years old, yeah.
All right. Okay.
Mhm.
Yeah, that's what I was thinking. I was thinking, since, you had not, maybe you hadn't had all your children, you still wanted more children, which is why you didn't opt for the total hysterectomy. But, okay. And so just kind of getting a little bit more into your cancer journey, in 2019, you were diagnosed. You went through chemo.
Mhm.
Did you have to go through What stage were you diagnosed?
So I was diagnosed as stage 2B.
Okay.
So it was stage 2B.
Okay.
Yes, I started off with a gynecologist who wanted me to do just radiation. But then I sought a second opinion, which I will also advise other women to do.
Sure.
And with that second opinion, they suggested that I should first do a surgery where they will put my ovaries up, so that whenever I'm going through radiation, it's not going to radiate my ovaries. But it was a 50% chance of me not going into early menopause. But unfortunately, I went in for that surgery. It did affect my ovaries. And at 39, I became full menopause.
Oh, Okay.
Yes.
Yeah.
So I was very young at that time, but I did go through chemotherapy in the same hospital and
Mhm.
I did my radiation in that same hospital. So I'll literally carry my backpack and my Bible and everything and I'll sit there through the day and yeah, go through the
Mhm.
whole process.
Mhm. And so today, prayerfully, you are cancer free. And how often do you have to go and get checked? Because I've heard that when you have cancer or have had cancer and you're in you've gotten past that hurdle of all of the treatment and your cancer is in remission, that you have and I guess depending on the type cancer you have, there are it's a routine of just being tested very routinely just to ensure that the cancer isn't back. So is there how often do you get tested just to ensure everything is okay?
So at first, so the more the as soon as all of the therapy you're done with all of the therapy, the number of times you go to the hospital is more often, and you keep getting checked. And as the years pass by, the more the tests come back negative, they spread out the number of times you go see the doctor. So for
Mhm.
me, I started off like every 2 weeks because
Mhm.
now not only was I dealing with having to be done with my chemotherapy and my radiation, I also my kidneys got affected because of the chemotherapy, and so I had to be seeing a urologist, and I was
Mhm.
seeing the gynecologist, oncologist,
Mhm.
and also I started seeing a GI doctor because the radiation was done around my abdominal area, so it gave me like severe constipation. So I had to be seeing all of these doctors all at once. But for the cancer itself, it took me like going from every 2 weeks to every month, now to every 6 months, and now I go every year,
Wow. Okay.
once a year,
Okay.
because my pap smear kept coming back negative.
Okay. Okay.
Mhm.
And so you have been cancer free for how long?
So since 2021, so 4 years.
Okay. All
Yes.
right. Well, great. That's great. And I love how you turned your journey, the adversity you had in your life and used it to help others. Especially, in in Africa where, we do not, I know they don't have the access to doctors and medicine like we do in America. So I think that that is phenomenal. And is there anything else that you'd like to share with us in terms of, your journey and what you think we should know um, as women of color? Because I know that
Yes.
we are affected, a lot more adversely. I know a lot of times we're diagnosed much later than our white counterparts. For various reasons, but for sure, I know that that is something that is common in our community, not going to the doctor or not having access or the means to go to the doctor. So, is there anything that you'd like to, share in regards to that?
Yes, I would like to share that, especially as women of color, I think that the thing that is so important to me is telling women educate yourself.
Mhm.
Because if you depend on somebody else to educate you about you, then there's a lot of information you're not going to have.
Mhm.
So I have learned over time that the best teacher of me is me.
Mhm.
And also the source of where you get your education from. So unfortunately, we have so many avenues of information now, and sometimes it's very difficult to decipher which area to go first. But I would say go to reputable sources. So, for example, don't go to WhatsApp for your information.
Right.
Don't go to maybe Facebook or one of these places. Go to reputable sites like Medscape or somewhere. Even
Mhm.
if the language may be a little bit harder for you to learn, you
Mhm.
are definitely going to learn if you take your time. I went to Cameroon, a country where some of the women do not even know how to read and write. And
Mhm.
I've educated them so much so that they themselves have taken on that education and are
Mhm.
teaching other women. And
Mhm.
then another thing I would say, screening. Make sure you get yourself screened. Make sure that if you have daughters in your house, to have the HPV vaccine.
Mhm.
I know that in our community, there's so much that is being said about taking vaccines and things like that. And so many people don't do that. But look at the myth versus the reality. That's what I always teach women, right? Look
Mhm.
at what is the myth and what is real. Get
Right.
your children, vaccinated, because that is going to prevent them. And it's not
Yeah.
just females,
Yes,
males as well. Like,
absolutely.
yes,
Absolutely.
get them vaccinated, get yourself screened, and make sure you listen to your body. I wasn't listening to my body. I
Yeah.
was having like huge menstrual cycles, and I was ignoring it as, oh, one of those things, you know. So
Right.
listen to your body, and if something feels off, go see the doctor.
So that was a symptom that you were having.
Yes, I
Yeah.
was having very heavy periods, and I was just assuming that because I had given birth to so many children, it was another normal
Yeah.
thing. But that was the main thing that was for me, and I was having like a little bit of cramps. But then I was still saying that those are menstrual cramps.
Mhm.
So we always give one reason why it's not, that thing.
Absolutely.
Yes,
Absolutely. And I think that the key is to be sure that you aren't just dismissing it because you don't want to know
exactly.
or you don't have the time or, I mean, if it's something that's consistent,
Mm-hmm.
definitely check it out. If it's just every now and again or it just happened once, then, there's likely chance that it's nothing. But if it's something consistent that
Consistent.
continues,
Mm-hmm.
then for sure that's an indication to make sure that you go get it checked out. So,
I completely agree.
yeah. Well,
Yeah.
thank you so much. We appreciate you, Imelda.
Thank you. Thank you. It's my pleasure.
Yeah, absolutely. And hopefully we'll be able to um, collaborate again and be able to kind of get your story out there, maybe even help you with your organization as well.
Of course. Thank you so much. I'll keep in touch. God
All
bless.
right. All right. Thank you. Same to you.
All right. Bye
All
bye.
right. Bye-bye. Tiffany.
Hey, hello, hello.
How are you?
Well, how are you? I'm happy to be
I'm
here.
good. I'm Angela. So nice to meet you.
Meet you as well.
Um, so we were actually on the tail end of our cervical cancer survivors story. So we actually had a physician, a gynecologist that gave us some information about cervical cancer as well that came on earlier. So Tiffany Reynolds is
Yes,
a nurse practitioner and you are in Dallas, is that correct?
I am. Dallas, right out 5 minutes from downtown.
Okay, all right, very well. And you specialize in women's health.
Correct. Yes, ma'am.
All right, great. So, what I'd like to do is give you the floor so that you can let us know exactly who you are and um, what you've been up to and the different things that we can expect in terms of the information you're going to share with us. Our goal is to try to get some information around wellness in terms of dealing with a diagnosis, cervical cancer, or really any diagnosis, honestly, but since it is cervical cancer month, that's kind of the subject today.
Mhm. Okay. Yes. Well, thank you. I just want to say thank you. A big thanks for just allowing me to use this platform to share. I love, love, love to educate women. I've spent 10 years in women's health, so this is
Wow.
amazing that we're dedicating this to women of color
Yeah,
in our community.
absolutely. Yes.
This is definitely a passion of mine. So I will get right into it as far as cervical cancer. Cervical cancer is near and dear to my heart. I have family members who have dealt with this.
Mhm.
Um, and I just wanted to kind of get some statistics. I don't think Black women understand how prevalent it is in our
Mhm.
community.
Mhm.
I just kind of want to put some numbers out there. Black women are 41% more than white women to be
Mhm.
diagnosed
Mhm.
with cervical cancer. And when it comes to mortality rates, we have higher mortality rates because one, we have a higher chance of never being screened.
Mhm.
And when we are screened, it's picked up at a later stage. So it's a lot harder to treat.
Right.
So it's really important for women to stay on top of their screenings. And the guidelines for screenings have changed over the years. So a lot of women, think they should be screened every year. The guidelines are every 3 years, as long as they remain normal. They have been normal in the past. Every 3 years is acceptable.
Mhm.
And as far as the numbers and the ages, if you're older age, you're going to be screened for a lot more things versus if you're younger.
Mhm.
When it comes to things like prevention is definitely a key when it comes to cervical cancer and pap smears. So pap smears is going to be your screening. It's not diagnostic, but if you have an abnormal pap smear, then that's when we go to more further testing for diagnostic to see further of these cells abnormal, or are they more inclusive to cancer. So we need to do, instead of 3 years pap smear follow-up, we're going to do a 1 year.
Mhm.
Um, Also, safe sex practices. Oh my goodness, condoms, protecting yourself, or women, especially young women, just protecting themselves and knowing that they can be exposed at any time. There is no really major symptom when it comes to cervical cancer. So it's kind of hard to detect. And HPV vaccine is a great way to protect yourself. Like regular screenings is a great way to protect yourself as well.
Mhm.
I did want to kind of share a couple of like symptoms and side effects from
Mhm.
cancer, because a lot of women think that, this could be normal, and it could be something else, like I said, leading to cervical cancer. So bleeding, irregular bleeding between periods, bleeding after menopause, even bleeding or pain after intercourse can
Mhm.
all pelvic pain that's undiagnosed that won't go away. These are all signs that could be leading to something serious when it comes to
Mhm.
your cervix.
Okay. And so another prevention method is vaccine,
Vaccine,
the HPV vaccine.
correct.
Um, Tell me, because my children, I have teenage children, and they both have gotten the vaccine. I think it's a couple of 3 shots, something like that. But is it just for the youth, or just say if, I don't know, somebody that's sexually active and is 30 years old
Right.
that wants to get HPV, are they able to get the vaccine?
Yes, however, the reason why the recommendations are early, even, the adolescent stage, is because the prevention is more effective as far as fighting the HPV virus when the vaccine is given before sexual activity, before the exposure. So
Mm,
before sexual activity starts, we want to get them at the adolescent age.
gotcha. Yeah.
And so if you get the vaccine exposed to those antibodies sooner, just like any flu shot,
Mhm.
chickenpox vaccine, we got
Mhm.
the prevention is really a staying ahead of it,
Mhm.
not waiting. So when you can get it at an later stage, is
Mhm.
recommended before 26.
Okay.
426 is really key as far as your immune system.
Mhm.
I've seen patients get it, in their 30s, and some of the CDC says you can go all the way to 45. But the
Okay.
thing is, if you wait later in life, your immune system has been exposed,
Mhm.
your sexual activity. So
Right.
yeah, the effectiveness does decrease.
Gotcha. Okay. I was wondering what that was about. Um, so as far as the HPV vaccine goes, I know that there was this stigma when it first came out. We as Americans, there are bolus of us who believe that vaccines are not safe. And it was just one more shot that my kids had to get, right? And I was just, all of the folklore out there about vaccines, and some people have, some negative interactions, and I can't necessarily say that it's, great for everybody. But the vaccine has been out now, how long for HPV?
HPV, it's been out, I want to say the Gardasil, they did change it. It's now 9 strains, but for about, I want to say 15 to 20 years, the CDC has changed it up because of the more strains that cause. But I want to say the HPV vaccine doesn't only protect cervical cancer.
Mhm.
It literally protects against so many other cancers: anal cancer, mouth cancer, vaginal cancer. That's why it's given to both men
Male and
girls,
female. Gotcha.
because there's not a test for men. There's
Right.
not an HPV test for men. So
Wow.
a lot of my patients will say, well, how can I get tested, or how can I get my partner tested for
Right.
I'm positive for this virus, and it's because of the exposure you have to your partner. But the thing is, with the HPV vaccine, just like any other virus, your body can fight this virus off. So say if you're positive, HPV positive for one
Mhm.
pap smear the following year, you can be negative, and your
Mm.
body just clears the virus just like any other virus that you can.
Okay. So really, I mean, because I was going to say, well, how do men get cured? But
And that's
your body fights it.
the cure is to start the vaccines early.
Mm.
So a lot of parents will think it's just females, but no. The biggest thing, and I know you talked about, anti-vaccine people are like, it's not the best thing, but at the same time, if we vaccinate our males, we vaccinate our females, and
Mhm.
these are the generations that are having these high sexual activities,
Right.
how we can protect against both males and females. If we're not
Mhm.
vaccinating our males and just our females, they can still be exposed. That's the thing,
Mhm.
trying to decrease exposure.
Mhm. Okay. All right. Very well. So thank you for that background. I appreciate you giving us some details and some stats, and that's important. Obviously, there are many barriers to access, unfortunately, for us. And I don't know if your work has led you to kind of discover some resources for your patients, or if you have a network that you tap into, if you are aware that, just say, if someone may try to come to you and they can't see you because they don't have insurance, or how would you pass some information along to someone in terms of, what they could do to see someone, if even if they don't think that they are or having any symptoms, but just need to go to a physician, to a woman of color, to have an exam, just to be sure that they are kind of keeping up with their health.
Right, right. Yes, it's really important. Like, I hate that it's the lack of access is a reason for our community and our population.
Mhm.
When it comes to access, I really put myself out there in the community. I go to the health department. I try to figure out what other ways can we help our women and meet them where they are.
Mhm.
Even with, I know here, Parkland Health, they deal with the underserved community, and they
Mhm.
a bus that
Oh,
goes
wow.
community. They do mammogram checks.
Wow.
Yes, they sign women up to get their cervical cancer screening done, get them where they need to be as far as a baseline, because
Mhm.
like I said, never been screened.
Right.
And
Right.
so, and especially when it comes to breast, it's just really just meeting them where they are, and
Right.
then providing them services where one is realistic, that they're going
Mhm.
to follow up. Because it's nice to see them right there and then tell them all the information, but are they
Right.
really going to follow through
Right. Right.
and get the things that they need for
Right.
their health and wellness, for prevention for sure.
Exactly. Yeah. Okay. All right. Great. And so, can you give us? I know that another facet of the things that you do is you um, are a health and wellness
Mhm.
um,
Yes.
advocate,
Yes.
and we really wanted you to also talk about, how mentally we can navigate when we get an adverse or a negative report, regarding our health, specifically since
Yes.
it's cervical cancer month, around cervical cancer, or breast cancer.
Mhm.
So just
Yeah.
wanted to.
I think the biggest thing, a lot of women, even unfortunately, when I have to give like a female, like a Black woman, negative report, it's a sense of guilt.
Mhm.
It's a sense of guilt. They feel like I did this. They blame themselves.
Mhm.
So my biggest thing is just letting them know and being that an emotional support, like give yourself grace. Let's start with there, you know.
Mhm.
Let's start with it's not your fault. There's nothing that you did wrong, you
Mhm.
know. And let's look at this as a whole and how can we like, you know, create a plan moving forward. And
Mhm.
if you're feeling this way, who can you reach out? Who can be a resource?
Mhm.
I will say support groups. Support groups are so major when it comes to just realizing you're not struggling, you're not in this alone, and
Mhm.
there's other women who are facing the similar challenges and that are going through similar things, feeling the same way, you know, have kids just like you, have a husband, and have a life going on all at the same time.
Mhm.
And so not just making sure women are not feeling alone, they're
Mhm.
not blaming themselves, they have some type of mental health where mental health support where they're either seeing a counselor, they need to sign or find a counselor, or
Mhm.
they need someone to just help support them and help cope and
Mhm.
grieve through the diagnosis.
Right.
I think that's really, really key. A lot of women feel alone.
Yeah, absolutely.
Yeah.
Absolutely. And, as someone who, and I know many of us have been touched by cancer, just in general. We've had family members, friends, maybe even ourselves that have, experienced cancer and how it can devastate not only the person that has it, but their loved ones as well.
Yes.
So just knowing the right things to say when you don't know the right thing to say is definitely key, and having that support
Mhm.
for that person, because sometimes it's not really saying anything, it's just going by, taking them a meal, sitting with them, listening to them, helping them get to their appointments, giving
Exactly.
them, mental breaks from the kids, allowing them to just do, without having those pressures on them in terms of, because we as women, obviously, we tend to bear the brunt of the household and, the rearing of the kids and all that good stuff. So, definitely, having those mental outlets and breaks, I think
Yeah.
is key for people that are diagnosed and,
Yeah.
going
That
through stuff.
sisterhood of that support system is really like, when I tell you a lot of women feel like they're in it alone, I'm like, no,
Mhm.
you're not suffering alone. It's so many other women. And then that's a kind of, it's like a relief for them. Like,
Mhm.
wow, like, okay, like maybe she really understands. She can relate.
Right.
You know, it's
Yeah.
different from talking to like a doctor or a physician about their diagnosis, but it's another to actually talk to someone who's going through it.
Right.
You
And
know, feeling the
experiencing the
same
same thing.
symptoms and
Right.
mentally, like it definitely touches them in a different way.
Yeah. Yeah.
Yeah.
Okay. All right. Well, is there anything else you'd like to share with us?
Um, I wanted to talk about nutrition
Okay.
and how it affects our Black community and
Absolutely.
women, and especially we're the ones in the kitchen.
Absolutely.
We're the
Absolutely.
ones in the kitchen and how it can affect our health.
Yes.
Just modifying. It's not just like making some small modifications can really go a long way when it
Mm-hmm.
comes to blood pressure.
Mm-hmm.
Our, health disparities in the Black community, blood pressure, your cholesterol, diabetes, pre-diabetes, those are the three main things that we
Right.
deal with that our diet and lifestyle is
Mm-hmm.
contributing to.
Yes.
So just different modifications real fast is low sodium, trying to change the sodium intake and low sugar. Low
Right.
sugar and low sodium can make a big change when your diet and
Mm-hmm.
your health as far as affecting your sugar level, your cholesterol level, because a lot of Black people don't realize the fried chicken and the back fat and the collard greens
Mm-hmm.
that can really build up in your arteries, and
Yes.
that creates risk for stroke and heart
Yes.
attack.
Yes.
So it's hard to get us to realize these
Yes.
things and
Yes.
how it can really affect us.
Yeah.
So I just want to put those
Absolutely.
key factors out there.
Yeah, absolutely. I mean, and what you eat
Hmm.
really does play a factor in your ailments and some of the diseases that we, could potentially get. So I definitely believe that, eating a lot cleaner is um, a benefit for us, not only, to ward off different diseases, but just, to maintain longevity, so yeah, for sure.
Comes to inflammation,
Absolutely. And
arthritis,
quality of
all of
life.
these things, chronic pain, like
Yeah,
you don't realize, hello, this is what we're doing to ourselves.
absolutely.
It can be
Absolutely.
prevented and it can be treated and reversed.
Yes.
Diabetes can be reversed. So that I love talking about and just educating women like, hey, it doesn't have to be a life sentence. It's not a death sentence. Like we can change this.
Yeah, absolutely.
Yeah.
Okay. Well, we appreciate it, Tiffany. Thank you so
Thank
much.
you. No, I have no problem. I enjoyed this.
Well, good, good. We hope to have you collaborate with us on some other things in the near future.
Awesome. Thank
All
you.
right. Okay, no problem. And you have a great day. Thank
You
you.
too. Bye.
All right, bye-bye. Am I still chatting, Jolie?